Great. So now we've got another question from the floor from Peter McMillan, the Executive Officer of NT Shelter, and I invite you to ask your question.
Thanks, Deborah, and I'd also like to acknowledge that I'm on Larrakia land today and pay my respects to Elders past, present and emerging, and to all other Aboriginal persons present. We're looking forward to more discussion and commitments on housing, starting off really from next week as part of National Homelessness Week. But for today, we've got a specific and important regional ask we'd like to put to the panel, and it relates to the issue of short stay accommodation for Aboriginal people coming to Katherine for medical, cultural, family, sporting and other reasons. So unlike Darwin, Tennant Creek and Alice Springs, there have been no commitments made by government or previous governments regarding short stay visitor accommodation for Katherine, despite studies highlighting the rough sleeper problem in that town in a region with 31 times the national rate of homelessness and a health service footprint that is the size of Tasmania and Victoria combined. In a survey that was done earlier this year, 94% of people who were in town for medical appointments were sleeping rough. It's 94%. That was due to having no short stay accommodation being available. We know that frequent attendees at Katherine's hospital emergency department are 16 times more likely to be homeless than not homeless. Today I'm pleased to announce that 19 organisations, including Kalano Community Association, Katherine Town Council, the Chamber of Commerce NT, the Australian Medical Association NT branch, Aboriginal Housing NT, NARJA and many other local and regional community sector organisations have come together to make a joint statement calling for an incoming government to address this as a matter of priority. This is one of those rare moments where business, local government and community have joined forces with a clear and shared view of what is needed for their region. So my question to the candidates is therefore, will you commit, if elected, to finally delivering appropriate short stay accommodation for visitors coming to town in consultation with the local Katherine community?
Okay, we will start with you, Natasha.
So we acknowledge that homelessness in the Northern Territory is unique in its context. If you're to talk to a homeless person in the Territory and ask them in 12 months, do they expect to be in that same location? The answer is probably no. We have invested significantly with 1,800 new or significant refurbished homes right across the Territory. We've bought blocks of land on in remote and urban areas, and certainly the work that we've done in Darwin, Tennant Creek and Alice Springs about short stay accommodation. Here in Darwin, the John Stokes Square redevelopment, there is a significant project, and we'd certainly look at that Katherine situation and work with the local community in the NGO sector. Certainly for me as the Minister for Health, when someone's in an acute hospital bed, that is a significant cost, and we don't want them having to come back in because of a lack of housing. So certainly happy to, I'm not going to commit on the spot to that level of detail, but certainly welcome the sector's request and happy to look at it in a genuine manner. Thank you.
Thank you. Leah.
Thank you. Yeah, and I guess my answer is two-pronged as well. Of course, we want people who need healthcare and support to be supported with that healthcare as close to home as possible, because when you're sick, you know, you want to be at home, not travelling around the Territory to have to access services. And you know, there are significant challenges in that, but I think during COVID we saw, again, that innovation and having to try and do things differently. So we'd certainly like to pursue that further. I have met with Kalano and discussed this with them, and again, happy to work in conjunction with the stakeholders to look at what an appropriate model for that region would be.
Thank you, Peter. The case that is put is compelling and very persuasive, and I think we need to see this as a model that is especially suited to Katherine, that then could be something that success may beget success. In principle, yes, I'm so persuaded by the argument that is put when you consider those that are sleeping rough, that are seeking medical care. It seems that the investment is made on one side and been lost on the other, and I just don't think we'd be making adequate progress otherwise. So I have met Kalano. I've had briefings around this issue in Katherine, and in principle, yes, I think we have to make that work.
Yes. Yeah, thanks, Peter. Yeah, it's you've identified a very clear issue and a very clear solution. And unfortunately, Aboriginal people are often forgotten, and their struggles and different circumstances. And I know that it's really expensive for people to even come into town, so let alone having to afford expensive accommodation. So I think it's absolute necessity, and yeah, I'm glad to hear that great solution. Thank you.
Great. And we know that if you live in the Territory, you're 12 times more likely to be homeless than if you live anywhere else in Australia. So it's absolutely a matter that we need to address. And on that note, I want to introduce Leanne Caton, who is the